Hello everybody, so thank you for joining me today, and in today's video we're going to be looking at the high yield CT head images that crops up time and time again for final exams. So the Medicine Guide is an online free YouTube channel which helps to support medical students all throughout their entire journey at medical school. So I've got videos such as how to be successful during the pre-clinical years at medical school, how to be successful during the clinical years at medical school, how to get the most out of GP placements, how to get the most out of hospital placements, how to be successful in your clinical OSCEs. Also, I've got a paediatrics edition focusing on high yield paediatric topics such as a child with a mass for finals, vomiting child for finals, congenital heart disease for finals, paediatric rashes for finals, high yield limping child for finals, and high yield genetic conditions for finals. In addition to that, I've also got an obs and gynae edition focusing on the high yield obs and gynae topics such as chronic abdominal pain for finals, gynecological cancers, acute abdomen for finals, obstetric emergencies for finals, high yield STIs for finals, and I've got a cardiology edition focusing on atrial fibrillation for finals, pleuritic chest pain for finals, infective endocarditis for finals, aortic coarctation for finals, high yield electrolyte disturbances for the ECGs for finals, and this video in conjunction with others will form part of my high yield quiz for finals, such as high yield abdominal x-rays for finals, today's video which is high yield CT head imaging for finals, high yield chest x-rays for finals, high yield nerve palsies for finals, high yield rheumatological and orthopaedic imaging for finals. So as long as you've got a pen and paper at the ready, we can get started. So today's video will involve a quiz, and I've condensed the imaging to 7 of the most high yield CT head images that crops up time and time again for finals. So let's get started. So as long as you've got your pen and paper at the ready, we can begin. So I'll give you 10 seconds to come up with a diagnosis from this image. Otherwise, you can pause the screen. Okay, let's find out the answer. So this is an example of an extradural hematoma. Now, the key features that you need to remember of an extradural hematoma is that an extradural hematoma presents due to a ruptured middle meningeal artery because of trauma to the pterion region. So classically in an SBA, this will involve a patient who's been hit on the side of the head with a cricket bat. So that trauma will lead to rupture of the middle meningeal artery at the pterion. Secondly, on a CT head scan, a patient will present with a lemon sign or a lentiform sign. And typically, one of the signs that a patient will present will involve a lucid interval. So after this blow to the head, the patient will initially be unconscious, and then they'll rapidly recover, and they'll seem quite stable to you for a period of time, but then they'll rapidly fall in their GCS score, and they will rapidly lose consciousness. So it's that lucid interval which is a key classic feature of extradural hematomas, and it's that classic description which crops up in SBAs, so just be aware of that. Okay, let's have a look at the next question. So you can either pause the screen at this point or wait 10 seconds, the choice is yours. Okay, let's find out the answer. So this is an example of a subdural hematoma. Now, a subdural hematoma arises because of damage to the bridging veins. And classically on a CT head scan, it will present with a banana sign. So remember the previous slide involved an extradural hematoma, and that presents with a lemon sign or the lentiform sign. A subdural hematoma presents with this banana sign. Now in the SBA, it will classically present in an elderly patient who drinks far too much alcohol and is receiving anticoagulants. So those are the key buzzwords that you need to be aware of in the SBA. Okay, let's have a look at the next image. So this is number 3. I'll give you a little bit longer for this because this one's a bit trickier. I'll give you 20 seconds for this one. Okay, let's find out the answer. Okay, so this example is of a subarachnoid hemorrhage. So a subarachnoid hemorrhage occurs because blood is collecting in the basal cistern. Now, a subarachnoid hemorrhage may present in a patient who has a history of berry-aneurysms, and this berry-aneurysm has ruptured. So that's one classical presentation of a subarachnoid hemorrhage. Now, on a CT head scan, a subarachnoid hemorrhage presents with a star sign or a starfish sign. So if you have a look at the picture in the top of the screen, you can see a pink outline of this star sign, and that star sign is recognizing the hemorrhage and the blood that's collecting in the basal cisterns. Now, typically in the SBA, a patient will present with a subarachnoid hemorrhage complaining of a headache, and this headache will be described as the worst headache they've ever experienced in their life. It will be an occipital headache, so a headache that's found at the back of the head, and this pain can radiate to the front. Also, there may be demonstrating some signs similar to meningism, so they'll be complaining of neutral rigidity or stiff neck alongside with this headache. Okay, so let's have a look at the next image. So I'll give you about 10 seconds for this one. This one's slightly easier, so you can either pause the screen if you like or wait 10 seconds. Okay, let's find out the answer. So this is an example of an ischemic stroke. So I think the management of an ischemic stroke is really important, and I think if they were going to examine you on any aspect of an ischemic stroke, I think that management would be the key, most examinable topic that they would crop out for the ischemic stroke. So let's go through this in a bit of detail. So a patient who is presenting with signs suggestive of an ischemic stroke firstly needs to have a non-contrast CT head as their first line investigation, and the whole point of performing the non-contrast CT head is to exclude a hemorrhagic stroke. Then we need to thrombolyse patients who are presenting within 4.5 hours of the symptom onset. Now, once the hemorrhagic stroke has been excluded, these patients can receive aspirin if it's an ischemic stroke. So just to clarify, once the hemorrhagic stroke has been excluded, the patient can receive aspirin. Then we would consider thrombectomy, and finally we would liaise with the other members of the multidisciplinary team to consider a long-term management plan for this patient. Okay, so let's have a look at the next image. So I'll give you 10 seconds for this. Okay, let's have a look at the answer. So this is an example of a hemorrhagic stroke. Now, a hemorrhagic stroke will be managed by the neurosurgeons. So patients who are presenting with a hemorrhagic stroke will need an immediate referral to neurosurgery because they will need surgical coiling. These patients can receive IV hypertonic saline if they've also got other signs of raised intracranial pressure. We can admit these patients to NCCU for intubation and ventilation. We can consider carotid endarterectomy if they've got carotid artery stenosis greater than 50%. Okay, so let's have a look at the next image. So I'll give you 10 seconds for this. Hopefully this is nice and easy. Okay, so this is an example of a hydrocephalus. So a hydrocephalus presents on a CT head with enlarged or dilated ventricles. Now there are three types of a hydrocephalus. There is an obstructive hydrocephalus, a non-obstructive hydrocephalus, or a congenital hydrocephalus. Patients who are suffering from a hydrocephalus will typically present with signs of raised intracranial pressure, such as a headache, papilledema, which is blurring of the optic disc on fundoscopy, and nausea and vomiting. Now the key investigations needed in a patient presenting with a hydrocephalus, first sign is to do a CT head, and as I said, on a CT head you'll be able to find enlarged dilated ventricles, such as the image on the screen. Now, a lumbar puncture is contraindicated in patients who have an obstructive hydrocephalus. The whole point of performing a CT head in these patients is to exclude patients who have obstructive hydrocephalus, because patients who have an obstructive hydrocephalus should not receive a lumbar puncture, because patients who have an obstructive hydrocephalus who receive a lumbar puncture will suffer from coning. So it's really important that you remember that a lumbar puncture is contraindicated in patients who have obstructive hydrocephalus. But in the other forms of hydrocephalus, a lumbar puncture is ideal because it helps to provide both diagnostic and therapeutic benefit. But please remember, if they have an obstructive hydrocephalus, a lumbar puncture is inappropriate in these patients. Okay? So let's have a look at number 7. So this is the final image of the day. So I'll give you 10 seconds for this. Okay, let's find out the answer. So this is an example of a cerebral abscess. So in a cerebral abscess, your first line imaging is to perform a CT head, and on the CT head it will describe a ring enhancing lesion and mass effect. You need to perform needle aspiration for the definitive diagnosis of a cerebral abscess. The management of a cerebral abscess involves 4 to 8 weeks of IV ceftriaxone, and this can be followed by a craniotomy and debridement. So thank you for watching my video today. If you enjoyed my video today, then please can I ask you to kindly subscribe to my YouTube channel. Please give my video a thumbs up, and please can I ask you to share this video with your friends. If you've made some mistakes and you didn't get some of the questions right, then please don't worry about it. Hopefully you'll be able to recognise the error of your ways and also be able to hit the exam paper running, because you've seen some of the classic high yield images that crop up in exams. So thank you very much for watching my video today, and I wish you all the best with your exams.